with respect to and how if you continuously use it. Yes.
Yes. My name is Dr. Gayatridas Gauthankar. I'm a veterinary officer for Government of Goa. Currently holding uh, so this catering with is a dominant area. It is predominantly a large animal area. Cater around 4,000. So this is stock portfolio. This is one of the major milk Goa. This taluka is one of the major milk pocket. You can say the total collection uh, and Sumul. The total collection comes to 60. So while this Sattari is around 25 to 30,000 liters. So we have a lot for as well as for as a livestock veterinarian, there are limitations for me. The treatment part, suppose so we the in our mind is like for the particular antibiotics, but like usually it happens. You try the symptoms, but it that is where the hematology and the antibiotics one disease investigation unit in Panjim, investigation unit. It is having its own limitations. Test to do a confirmatory brucine. We have to take the samples to and the result takes at least not less than 45 days to come. So this is a issue. I think uh, this case gets delayed and ultimately farmer suffers. Let me give you an example. I got introduced to Roche. Has his own diagnostic techniques. So he want to in my place since this place is in area. So I happen to who was actually having means you were having see fever. It is like a contagious fever, and we were treating the cows. Uh, so I suggested to get in touch with Roshan. Yes. It was already 3. We were treating the cows, but the cows are not having any kind of symptoms, and on one cow. So sampling, and we did the test with Roshan. We did the test, got the result, and with the result of FTO4 sensitive. So medicine, the occurred in 2 days time. This is one live example which we got able how the farmer is very happy, pretty sound, but not getting deal. It was get the process delayed. So this is because of this early diagnosis. Now plan that he will farm his screen and he will shortcomings accordingly. I think he has got it. Similarly, farmers which are linked to God area, I think they are in touch, and even he has even those farmers have got precise from Dr. Roshan's lab.
Okay. Is there anything else other than this
Uh,
with respect to the application, maybe in the future?
yes, hence I would suggest, I would write, if it is possible, suggest uh, medium to the message either government should take up the services, Roshan should be a like third party provide this service to government because at, at the moment we don't have infrastructure which Roshan has.
Okay.
Either build up, it will take a lot of time. It takes his own government how it goes unless and until the comes at the grassroots level. If diagnostics techniques comes to the more easier and also if on affordable prices like is only possible if it comes through the government. Yes, and it would be easier and it would be easier uh, prevention for the livestock. Ultimately, optimizing the production of the livestock, which is what livestock is rare.
Got it. Doctor, one more thing. If you want to implement it in the rural areas, especially India. Now there are two
Yes,
things. One is to individual farmers because it's going to be a very costly. So
yes,
there has to be a channel partner that is, let's say, the very on local, what is the hospitals which we have in the now.
you can say
So
animal husbandry department.
20 departments, but how to make it to be always a government intervention, right? It's to an individual capacity. So, do you think that if as a doctor would be able to give a bulk order and receiving a government order for this particular, you'll be able to encourage it from your end, and if in what level it would be?
I would definitely, and I would uh, uh, there are marginal farmers. Farmers, they will almost farmers will definitely not be able to if it is the if the rates of the test are pretty high. There are which we engage with. He is pretty financially. If we can definitely educate and encourage, but military that it would be pretty difficult to reach that.
Got it.
Definitely go ahead. We can definitely facilitate taking the samples and sending it through Roshan local transport. We have our local office local vehicles, so we can the cost of the test
Got it. Got it.
for that we support. It should be a government support, or the rate should be like substantially low so that a farmer can.
Got it.
Yeah.
All right. Thank you so much. No, and I believe thank you so much. Saturday.
Yes. Yes. No, I'm at my
Oh,
dispensary
okay.
at the moment.